suffer because of the change in the domain or on the distribution. It should become resilient to outliers. What it means, like, it is very common in medical domain that the rare diseases, the data will be very limited. Data imbalance is it's a severe case when we get the outliers, right? Now, it should not happen that the model becomes just goes haywire, its output, its prediction becomes totally garbage if it sees a data from a rare class. So robustness means that as well. And then comes the clinical implications. If a model has been deployed in certain workflow, right, it is important that the model is reliable, right? Its performance, if the model is not robust enough to the environmental factors and all, it may result into wrong diagnosis or wrong screening, wrong prediction, and can lead to some sort of a medical legal troubles as well. Right? So all of these are the expectation, and all these characteristics are not confined to the medical domain only. They are highly generic in nature, and they are expected in all those models which are used or designed for sensitive applications like healthcare, medical, or security, safety, etc., surveillance, those kind of things. Right. So coming back to the medical image analysis model, like if we try to focus just on the models which have the ability of performing the image analysis, or maybe specifically the medical image analysis, we'll try to maybe understand a little bit more what we mean when we say that the model is not robust enough. Right? So let's say we have the data set of X-ray images. We have designed a convolutional neural network which can take this X-ray image, then it produces the feature vectors or feature map at the output layer. So let's say just before the output layer, if we consider the coarse features or the very highly semantic features at the output of, let's say, the penultimate layer of this deep neural network, which is just before the output, we can actually do some analysis over that space, this feature space, which we can call as feature embeddings corresponding to individual samples. If we try to plot them in a downsampled space using techniques like PCA or t-SNE, the plot will look something like this. What is seen here on the screen? Let me see. So I hope you can see the cursor. I'm moving the cursor.
Yes, sir. Yes, sir.
Okay, so I'm not able to use PowerPoint, so please bear with me. But I hope I'll be able to draw your attention toward what I'm pointing out. So just focus on this feature embedding. So this is just a representation, right? So when a model has been trained, and if it is doing a good classification, it is possible that we can observe some sort of a separation building up among the different classes in the feature space, the feature embedding space. Now remember, this space is a this is a low dimension space as compared to the original image, right? So that means the separation which is getting built up will also be limited. Now, if you provide even a little bit of a push to one of the points from one of the cluster or one of the class, it can jump into the other one, and your classification performance will become bad. Right? So that's the meaning when we say that the model is not robust enough. That's what it means, that even the small perturbation in the image space will lead to the certain amount of perturbation in the embedding space, such that the model which was originally doing well will start doing the misclassification or doing the wrong prediction in other applications. Right? So making these, which eventually makes these models unreliable. Now, when I talked about these small perturbation earlier, right, these delta perturbation or the change, right, these are like the natural degradations, right? For example, noise which is coming, or the degradation of in form of, let's say, motion blur because of the patient movement and all, right? So those are like the naturally occurring corruptions or perturbations which degrade the performance. There are other category of perturbations like adversarial attacks. I'm sure some of you must be definitely aware of what exactly are the adversarial noise. So these noises are the specifically designed or created noise by inverting the exact same process which has been used to train a model. So if we train the model using gradient descent with the help of backpropagation algorithm, these adversarial noise are are designed with the help of same algorithm, and then they are added to the input image. And what happens is that the model starts failing on those images which are coming with the adversarial noise. Now, if you notice on here on the picture, what is shown here on the screen, the top row shows the normal images without the adversarial noise, along with their heat maps. Right. So these heat maps are the regions over which the model has paid most attention, or it has focused while taking a decision. On the bottom row, you see the heat maps corresponding to the images which have been adversarially attacked or which contain the adversarial noise. If you just compare the two images, the two rows of images, the noise is imperceptible, almost invisible or like unrecognizable to the human being. But if you compare the attention maps of the model for the original and the noisy images, you will see a big difference. The model attention has gone just randomly everywhere except the region where it should have focused, where it was originally focused. So that's what the targeted attacks are. Like, they are trying to disturb the model focus from where it was originally focusing on and just diverting it to the other region so that the model will not have the ability to perform correct prediction. Right? So why exactly these models become so vulnerable is that most of them, they rely on these non-robust high frequency features like the sharp change in the intensity, fine edges, small structures, the regularity of the structures, etc., which makes them vulnerable to these kind of adversarial noise. So when we say that the model has to be robust, it should not get affected with these kind of noises and perturbations. There's more to it. There are other reasons which can make the model perform bad. And when we want a model to be robust, the model should not get affected by these factors as well. For example, the spurious overfitting, data set bias, which is very relevant in case of medical because the rare diseases are often less represented in the overall data set. Then distribution shift, as I gave you the example of like comparing the data from one machine to the other machine, right? So all of these can cause the model to perform poor. And if a model is robust, it should be able to handle these issues, right? Now, how can we achieve this robustness? Right? These are the characteristics what we want, right? What I just discussed are the attributes of robustness and basically a robust model, what we expect from it, right? Now, what are the ways with which we can actually do this or achieve our objective or achieve robustness, right? Ensure robustness in a medical image analysis model? There are various techniques, strategies which can be broadly categorized into three categories. The first is data-centric strategies. So it is obvious to see that when we say again and again that with the limited data or biased data, not enough represented data leads to the models which are not robust enough. So if you increase the data somehow through synthetically increasing or by collecting data from multiple sites, it can naturally bring in the robustness. But it is obvious to see that it will have its own limitation. Right? How good are your augmentation? How much effort can you put in the collecting and increasing the size of the data? All those are the issues. Right? And the second category is model-centric strategies, which are not specifically focusing on increasing the size of the data, but they are actually trying to improvise the model itself. Right? So this could be like retraining the model with after adding adversarial noise and perturbation, or using some sort of an ensemble where you have multiple models trying to solve the same, trying to achieve the same goal, same objective, and you hope that even if the noise or the degradation come, at least some of them will be not failing on that degraded input, and your overall performance will be maintained. Right? Then there is ways to like uncertainty estimation, calibration, and all, so that we can actually decide whether the predicted outcome by a model is reliable enough or not. And the third category is a form of different paradigm of the learning itself, right? Where we consider distributed learning, continual learning, where the model learns about the problem in a stage-wise manner. and the issues of collecting large data and all can also be sorted out. But all these three, they have their own respective limitations and challenges. So we try something else in our work. We design a codebook driven feature retrieval method where instead of working on the data on the model, we try to work on the embedding space, the feature embedding space. We try to reduce the capacity of that space in order to make the effect of perturbation go down. So this work is led by my PhD student Ajad Singh in my lab, which we call as Medical AI Systems Lab, or MASIS in short, with the team of other students. So let me just describe what exactly our work is. Before going into that, if there's any question so far, I can take that, or maybe I can take the question at the end. Uh, should I go on, or should I stop for some questions?
Yes, sir. You can continue, sir. At the end, we will discuss.
Okay, so let me talk what exactly did we do in our work. So what we said is that what we did is we utilized the idea of something what is known as vector quantization. Sure, some of you might be familiar with it. This term vector quantization is currently very popular among the generative AI models, right? So we try to utilize the benefit of it or the impact of that on the feature space for the robustness, uh, to ensure the robustness among the models. Right? So what exactly is the idea of a codebook? It is as follows. So what we do is that we define a codebook, which is nothing but a dictionary of D-dimensional K code words or prototype vectors, right? So since it is a code book, we can call individual of the element of that code book as a code word, right? And we utilize this dictionary or this code book to quantize the feature space. So what do we do is that let's say an image is coming as an input and it goes into a CNN model or any let's say a transformer model, and it provides us a feature map or a feature tensor, let's say Z here at the bottom. Now we take this feature map and we consider individual vector along a particular dimension, let's say along this dimension, along the depth in this picture here on the bottom right, this dimension D, right? So we consider individual vector, we pick up that vector, we compare it with all the code words in our code book, right? And replace this original feature vector with the corresponding code word. Now, in order to do that, we need to ensure that the size of the feature vector and individual code words, they match with each other. And we need to ensure that these code words are learned while training the network. Right? So there are different loss functions which are utilized to train this model. But in a nutshell, if you intuitively try to see, this is nothing but saying that we are going to cluster the embedding space just the way K-means clustering works. And then centroid of each of those clusters are nothing but these code words. Right? In a simple sense, to understand, this is what happens in case of vector quantization using codebook. Right? But in reality, there is more to it. Right? How do we train this codebook and how these code words are trained? That takes you have multiple loss terms, including the reconstruction loss and commitment loss and the category loss, etc., which ensure that this code book is actually learned as a dictionary of the given data set. All right. Now, if you see how after quantization, what happens, you can focus on this bottom picture, the small square here at the bottom, the blue color one. If you notice, there are some numbers written over each cell. What these numbers tell that, let's say this cell where the 1 is written, that particular feature vector from this ZE was replaced by the first code word from the code book, which is E1. And now we have a quantized feature tensor or feature map, ZQ, where your vectors are replaced with these code words E1, E3, E2, E4, etc., etc. Right? So once we have this quantized feature map, we can actually perform prediction on this feature map rather than doing prediction on the original real valued feature vectors or the feature path. So what exactly happens pictorially if you try to see on the feature space, it can be understood very nicely with the help of this Voronoi diagram that what you see here, these red dots are nothing but your code words, and these crosses are nothing but the original vectors ZE. Right? So those crosses are these green color vectors, and the red dots are these magenta color code words. Right? Now, if you see, this diagram can help us in understanding how this quantization process is enabling the robustness in the model. Right? Now, suppose some of these feature vectors, these process, let's say they experience some sort of a perturbation due to any kind of a degradation in the input, or let's say noise. What will happen? Their position will move slightly, but probably they will not skip the corresponding Voronoi cell, right? Unless they are at the boundary. Let's say, for example, here, this one may go to the other cell. But even if some of these skip or go to the wrong cell, not all of them will go to the wrong cell, right? What it means that if the majority of these real feature vectors still get mapped to their corresponding code words, the decision will not go wrong. The model will still be able to perform the correct prediction, even in presence of noise, right? So that's exactly is what the benefit this codebook driven quantization or feature retrieval provides us. To correlate it more from the medical imaging point of view, just focus on this right hand side figure, right? So a very important characteristics of any medical data, the general application specific medical data, is that the images are mostly homogeneous. What we mean by homogeneous data is that, let's say if we are doing some analysis of the chest radiographs, the entire data set will contain only the chest radiographs, the chest X-ray images. No other image will be there, but there will not be any X-ray image of any other body part or any other modality. So data is going to be very nicely designed, curated, and will be completely homogeneous. Now, in order for this codebook to work and perform the correct classification at the end, it is necessary that the regions which are similar across the images should get mapped to certain fixed code words. For example, here this orange regions which represent the healthy portion of the lungs in the upper lobes may get mapped to the code word 0 in the code book. Right? The blue one, which are possibly representing the diaphragm region of the lung, they may get mapped to the code word 1 or more than one code words, a set of code words. Now, when that happens, it is implicitly a disentanglement over different regions of the input image is happening due to this division of code words, right? And then even if there's some perturbation, the code words do not get disturbed because they are latching onto the region, not onto the pixel. That's the difference, right? And that's how it is able to ensure that the correct mapping continues and the model is able to give the robust performance, right? That's the idea. So this was the initial observation and attempt from us. We then subsequently extended it for hierarchical code books and multi-level code books, right? Where we call them as scale-aware adaptive quantization. So what we observe is that these deep networks, which we all know that they provide hierarchical features, right? They are not just giving us or delivering us the features at the end, right? At the different layers, you can actually apply the hooks and find out the coarse features, fine-grained features, structural features, etc., etc. So why not to use them and perform quantization, learn separate code books for individual of these set of features, right? So we are now talking about code books at different scales of features, right? So there will be as many code books, as many feature vectors or feature maps we are taking from the model at the intermediate layers, right? Now the advantage is that we can get information at different scales and different granularity, right? From the bottom layers, we can get information about the fine-grained features. From the top layers, we'll get the information about the semantic features. Now, once we have all of this quantized through their respective code books, we can combine them, right? So what we propose is that we should combine them with the according to the information content present in those code books, right? Given the particular image, we can measure the amount of information provided by individual code books, and accordingly, we can provide the respective weight and get the final quantized features corresponding to the given input image, right? So they are naturally going to be rich as compared to a single code book and more robust as compared to the single code book, right? And we do observe that in terms of performance gain, not only on the perturbed data, but also on the clean data, right? So since we are now making the feature space discrete and we are actually reducing the capacity of it, what it means is that we are basically trying to make this feature space finite. In case of real feature maps, the feature space is infinite, has an infinite capacity, and the feature vector can represent any point in the real world space, right? But once the quantization comes into picture, this feature space becomes discrete, and which naturally allows the model to have more the enough information to provide the desirable performance, and that leads to the performance gain as well. We tried this idea on various different architectures, right? Here we are showing the results which we obtained on two different data sets, ISIC skin data set and the chest X-ray NIH data set. And we observe that there is a consistent performance improvement once we have the scale-aware or multi-level code books into picture, right? Note that this is only the standard classification task. The ISIC is the standard, the single class classification, where the chest X-ray is multi-level classification task. And here they are not testing the model's ability to get avoid the degradation. Here we were just trying to observe that incorporation of code book, is it helping the model to perform better, or is it degrading the performance of the model? Right? To our surprise, it is giving better performance, although we have the explanation why it happens, right? Because the clutter in the feature space is going down, and the task for the model becomes easier, and it does well, right? Now, coming to the point which is of our interest is the robustness part. So we tested it for different types of perturbations. Here I'm showing one result on NIH test data set. We compared that with the existing baseline, the SOTA baseline for the robustness, which is called as VQSA, right? That was using just single code book only, and our model with this multiple or scale-aware code books showed a consistent performance improvement with a large margin over the existing standard and the SOTA baseline, right? Which is what we expected, right? When we say this corruption robustness, this includes noise, motion blur, and other artifacts, right? We tested the same idea for the adversarial robustness also, and we saw that the model is able to improve the performance, although not a very large not with a very large margin. We are going to further study on that part, but still there's some improvement over the existing methods, right? Which is a good sign and a good indication of adopting these kind of code books for these models designed for medical image analysis, right? Again, coming back to where the model is paying attention, right? So if you compare these are 4 cases shown here for 2 different data sets, which we have considered in our study, right? As you can see, the proposed model where we had using these scale-aware code books, the attention is rightly on the location where it should be, right? For example, if it is predicting infiltration or effusion, it is focusing on the lung boundaries and the diaphragm region, the surroundings. For the hernia also, and same is the story with the skin lesion classification, right? So code books are not only helping in making a better decision, but also ensuring that the model attention is confined to the region which is sensitive for making the correct decision, which was a very important observation. We then extended this idea of the multi-level codebook and quantization to other problem as well. And this one was a survival prediction from the CT images for the head and neck cancer patients. Right? We used Hector data set, and what you see here on the screen is the outcome observed with the help of Kaplan-Meier curves, where the objective is to understand whether a model is able to segregate high risk group from the low risk group or not. Right? So the magenta or pink color curve here in every plot represents the low risk group of subjects or the patients, and the gray one represents the high risk patients. So when there's overlap between the two regions or the two curves, right, that is a bad model. When we see a clear separation, that is a good model. That means it is able to tell that which subject is at high risk and which subject is at low risk, because it is hard to exactly predict that what is the survival time for an individual patient. Right? All these models, we can expect that they at least tell us whether the survival chances are high or low. Right? So if you see the comparison on the bottom right is what is the output of our model, which is actually employing this quantization, and there's a very nice separation as compared to the other existing state-of-the-art deep learning-based survival prediction methods. Right? So I'm not going into the detail of this work, but the key component here, which is common from with the previous work and this work, is the quantization or the scale-aware code. Now, let me conclude this, and then probably I can take some questions to finish this talk. Is that we want the robustness, it is desirable for medical application, medical image analysis models. And we observed that incorporation of code books in these models helps in achieving that robustness, or helps in designing the robust models. We have done some work which is just like scratching the surface. There's a long way to go, and this idea is definitely promising. It has shown its impact, strong performance, not only in the clean data, but also on the perturbed data for at least for two modalities, and not just two modalities. We have, since we have done the experiment with survival prediction, so across the task, across the modalities, we have observed consistent performance improvement. Our idea of utilizing this scale-aware code books is benefiting, but it can be further improved. There is a lot more work which can be done over these code books itself to make them specifically work for robustness, not just the performance, and that those are all the other things which show a promising future direction for these works which we have done. Other than that, there's a lot of promise in combining this particular idea of codebook driven robustness with the other existing strategies of bringing in the robustness into the model, like distributed learning and the data driven strategies and all. Right? So they are complementary in nature, and we believe that once we combine, which we are doing right now, that once we combine those, we can beat even the performance is what we have observed till now. So that's all about what I wanted to talk in context of robustness, what we have done, what is available around, and what are the future possibilities. And let me once again thank you for this for inviting me today. I believe I can take questions now, and if there are. Thank you.
Yeah, thank you so much, sir, for your wonderful talk on robustness in medical imaging domain. And I hope participants have at least got ideas that what do you mean by robustness and how to take care of that. And 1 and 2 already, I mean, already I think Professor Misra has already shown their work, which is really promising. So now I request participants, if you are having any query, sir can easily take your questions. Sir,
Okay.
they can only write their,
Okay. Yeah.
they can only ask queries through the chat box.
I have opened the chatbot now, so I can see one question from Shivanshu
Yes.
about the trade-off between using a small versus large code books and the in terms of the performance, right? A very good question. So we tried this and designing code books of different size, and so one dimension of code book gets fixed according to the feature embedding what we obtain from the model. What we can play is with the number of code vectors in the code book, right? So that's where we can do the variation in terms of the size of the code book. So what we observed that a very small code book is not able to deliver the desired performance due to the limited capacity, or what I would say, the over quantization, or let's say not over, the under quantization of the feature space. And at the same time, if you have a very large code book, that also leads to the over quantization, and eventually these cells, the Voronoi cells, becomes too small to actually provide you the desired space for perturbation and handling that perturbation, right? So small code books impact the performance, although they provide the good robustness. On the other hand, the large code books, they provide better performance, but the robustness aspect goes down. So it's always a trade-off that we try to have a reasonable size. And of course, one limitation comes from the fact that how much can your GPU accommodate, right? So those system constraints always bind your hand that how large can you go, how big you can design your the code book. I hope that answers your question.
Mm. Any other queries from the participant side?
Okay, there's possibly a follow-up question that is there any potential for combining codebook driven retrieval with contrastive learning? Very good question. So the results what I have showed you right now are from all the experiments we did with the supervised learning. But we have already done this task of bringing code books into the self-supervised models, right? Because they naturally, and they so many of these self-supervised models, they rely on Siamese kind of a configuration of the models, whether it is contrastive or non-contrastive, right? Now, bringing code books there helps, although we have observed some sort of um, curious phenomenon that incorporating codebook in target branch provides more benefit as compared to the online branch, which is getting trained. We are doing the analysis that why exactly is this happening and how is this affecting the overall performance. But one thing for sure, which I can tell you, that we certainly see the improvement in the performance, and the reason is still the same, that the representation space where we are actually learning the embedding is getting constrained, and it is helping the model for doing the subsequent making the representations more generalizable as compared to the data specific or specific to the given input. Yeah. Any other question?
Yeah, any other questions from the participant side? Uh, okay, sir, I have only just one query. I mean, just simple query, sir. Yeah. So, I mean, when you've shown also one slide where you mentioned about domain adaptation or domain generalization, I think. Yeah.
Right.
So, where also you've mentioned something called as OAD, out of distributions and all.
Right.
So,
Right.
I mean, when it is captured, I mean, in different demographic regions, different machines, so we can call it as OOD, right? Out of distribution. That's what you mentioned.
Correct.
So what kind of approach? I mean, can we also design this type of approach, or what type of approach can deal with
Yeah.
those type of
So,
problem?
specific to the handling out of distribution data, there are already many approaches which do exist around, and these involved the continual learning kind of an approaches, or the model calibration approaches, which can actually differentiate between input in distribution data and out of distribution data, right? And there are anomaly detection approaches also which do exist around. But specific to what we did in our work, right? What we have observed that if we consider, let's say, so domain generalization and out of distribution are sometimes they can be separated out, right, depending on the application, right? So if I take an example to explain it better, let's say we call data obtained from one site as in distribution data, and data obtained from the other site as a out of distribution data. It, this can also be seen as a domain adaptation problem, right? Where the domain data from we have data from from a source domain and the target domain, and we want our model to get adapted to the target domain data as well, right? And the difference could be the demographic difference, or the system or the machines which are different at different locations. But the model should not suffer from that. That's what we want, right? When we say that the model should be able to generalize across the domain. Now, specific to what we did here, we observed that this kind of quantization brings in this domain generalization behavior to a large extent. And that's the reason, while answering to the previous question about this contrastive learning part, I mentioned that the features are the quantization is helping the features to get generalized, right? Because it is allowing the model to focus only on the task specific features and ignore the domain specific features, because the task in our hand is forcing the model to extract those features which are helping in making a decision, right? Now, if the domain is getting changed, but our task remains same, remains same, it is likely that those task oriented features will also remain consistent. And when that happens, this quantization makes a big difference.
Yeah. Thank you, sir. Thank you. I think there are two queries in the chat box.
Okay, so I see, can we use the same code book across different domains? Yeah, so probably this and the relevant question which I was earlier answering, right? That if the task remains same across the domains, and we have the quantization in place, right? The idea is that the code words will get latch on to the task specific features, right? And when that happens, that means this can actually help in domain generalization as well, right? And precisely the reason that we are able to observe the generalization ability in the representation space when we employ the code books.
Yeah. Is there any? Yeah, I think there is.
Probably I missed this one. Will it be helpful for a typical? But I think these are the related questions only, right? That whether
Yes,
it
yes,
will
you have already mentioned.
scale it across the domain or not.
Yes, yes, sir, absolutely. Okay, sir. I think you have already answered all the questions, and these are all the follow-up questions. I mean,
Okay, so
yeah,
thanks a lot once again. I had to rush a little bit through my presentation to make up for the lost time, but I hope I had been able to help you understand what exactly do we mean from the robustness, and what are the some different ways it can be achieved, and specifically the way we have utilized. If you are interested to know more, I'll be happy to maybe chat later on. You can write to me approach me, contact me. I'm always open for collaboration and obviously looking for good students and all. So feel free to contact me if you want to know more about these works or any other work which I do. And Dr. Nayak, thank you once again for inviting me here.
Thank you, sir. Thank you for taking out time and speaking
Hope
to
hope to
us.
see you sometime in person.
Yeah, yeah, yeah. Yes, sir. Yes, sir. Very soon. Okay, sir. Thank you so much,
Okay,
sir, for joining us and for a wonderful talk.
okay. So I'll log off now.
Yes, sir. Thank you so much. Okay, so participants, we'll be having our next session after 5 minutes. Professor Kuldeep Singh from MNIT Jaipur, right? So he will join us very soon.